Nursing care related to elimination needs. Significance of excretion. Excretion serves to remove waste product from the body. The waste product include urine, feces, sweat, carbon dioxide, etc. Excretion is an essential mechanism of the body to stay healthy. Moreover, the excretion, urine, feces show the state of the health of the individual. It is important to provide nursing care based on the reason why nursing care is related to elimination needs necessary. Excretion is an activity that makes people embarrassed. It is important to support the user by understanding how she or he feels when provide care related to elimination needs. Mechanism of excretion. Excretion of urination. The urination is formed in the kidney, then stored in the urinary bladder, and finally excreted through the urethra, which is called the urination. When a volume of 200 to 300 ml urine is in the urinary bladder, the individual feels the need to go to the toilet, which is called the urination urge. Regions of the body related to the forms of urine centers involved in control of urination, they are called the cerebrum, the brainstem, and the spinal cord. Action of the kidney. The kidney filters waste product from the blood and forms urine. Function of the ureter. The ureter is the tube that transports the urine formed into the kidney to the bladder. Function of urethra. The urethra of the male is long and the female is short. The male urethra is surrounded by the prostate. Function of the bladder. The bladder is pouch that stores urine at its capacity of 500 ml, and individual feels the urge to urinate when about 200 to 300 ml is in his or her bladder. Mechanism of defecation. The food and liquid consumed orally are transferred from the mouth to the stomach, where digestion begins. The food and the liquid then move to the small intestine, where the nutrients and the water are absorbed. The waste product, etc., remaining after absorption becomes feces and are expelled from the body. This is called the defecation. The feces accumulate in the intestine of an individual. He or she feels the needs to go to the toilet, which is called the defecation urge. The urge disappears as time passes. Region of the body related to the formation of feces. Number 1, oral cavity. The food taken from the mouth chewed and mixed into the saliva for easier digestion. Number 2, esophagus. Food passes to the esophagus. Number 3, stomach. The peristalsis starts when the food is sent through the stomach and the food is digested by the secreted gas juices. Number 4, small intestine. The small intestine is food is digested and nutrients and water in the food are absorbed. And then number 5 is the large intestine. Feces are formed passing to the ascending colon, transverse colon, descending colon, and the sigmoid colon. And last, this is the anus. The anus feces are excreted. From the anus. Posture during defecation. Assume a forward bend posture with the heels up. The posture makes it easier for the feces to pass through. When the path from the rectum to the anus, the exit for the feces is set straight. The appearance and amount of urine and feces. State of urination. The volume of frequency of urination are affected by the environment and disease. Normal and abnormal urination. We have the normal and abnormal urination. The volume for the normal 1,000 to 1,500 ml per day. Abnormal is 2,000 to 3,000 ml per day or more is called polyuria. 300 to 500 ml per day or less is called oliguria for the abnormal. Okay, 2,000 to 300 is polyuria abnormal, 300 to 500 or less is oliguria. Frequency, it's 4 to 6 times per day. It's normal. 10 times or more is abnormal. Polyacuria. Smell, no smell for the normal. For the abnormal, there is a strong ammonia smell. The color, light yellow or transparent, normal. Muddy, dark brown, red, etc. Abnormal. State of defecation. Defecation is affected by the consumed food, disease, etc. Therefore, the shape and color and frequency change depending on the situation. When you provide nursing care, you need to know the state of the normal defecation of the user. Normal and abnormal defecation. For the normal defecation, the frequency is 1 to 3 times per day. The color is dark brown. For abnormal defecation, the frequency is infrequent or constipated, and the color is red, black, white, etc. So, tools to use improving nursing care related to elimination need. There are various tools of elimination need. Use the tool the best suits for the condition of the user. Whereas there are various tools for elimination needs. We have the portable toilet. A portable toilet is used by those who feel the urge to urinate, defecate, but are unable to go to the bathroom, and for nighttime toilet use. For the portable urine bottle, bed or bedpan, portable urine bottle for women and for men, and bedpan. Those are tools used by those who feel the urge but bedridden, in poor physical condition, and have difficulties in maintaining a sitting position. We have a diaper incontinence pad. This is for those who are not aware of urination, defecation, urinary defecation, fecal incontinence, and those who are difficulties in using portable toilet, etc. So the effect of reduced function and disorders of excretion, urinary incontinence, and constipation or diarrhea. Urinary incontinence. Urinary incontinence refers to the involuntary leakage of urine. Kinds of urinary incontinence. We have a stress urinary incontinence. The condition is urinary leakage due to coughing, sneezing. I think this is me. Stress urinary incontinence. Sneezing, etc. causing abdominal pressure. We have the urge incontinence. This urge incontinence, the individual gets feeling wanting to pass urine but cannot hold and suffers urinary leakage before getting to the toilet. Sometimes ganyan ako, urge incontinence. So, overflow incontinence. Minor urinary leakage occurs because the urinary tract gets closed due to prostatic hyperplasia. Hindi naman to. Reflex incontinence. Leakage of the urine occurs due to spinal cord injuries. Reflex incontinence due to spinal cord injuries naman to, yung leakage. So, we have the functional incontinence. Leakage occurs due to individuals cannot complete all the movements related to urination in time. Leakage occurs as individual cannot make it to the toilet in time because he or she does not know the location in the bathroom due to the dementia, pag functional incontinence. So, yun, stress urinary incontinence, urge incontinence, overflow incontinence, reflex incontinence, and functional incontinence. So, yung functional, pag may dementia, reflex, pag may spinal cord injury, overflow incontinence naman, pag nagkaroon ng clog dun sa urinary tract. Urge incontinence naman, yung pag hindi niya ma-hold, papuntang CR, nagkaka-leakage na. So, yung stress naman due to abdominal pressure. Constipation. Constipation refers to the state in which the frequency of bowel movement and volume of feces are continuously lower than usual. So kinds of constipation, we have constipation, functional constipation, and organic constipation. So for the functional constipation caused by bodily function. Organic naman, constipation that occurs when the path of the feces is blocked due to tumor or inflammation. Points of nursing care. Make it a habit of the user to go to the bathroom regularly. Have the user regularly drink an adequate amount of water. Include a good amount of dietary fiber and use fiber in the user diet. Include exercise in the user's daily life. Report to the medical staff if the user constipation does not improve. Diarrhea. Diarrhea refers to loose of watery feces. Diarrhea refers to loose or watery feces. Points of nursing care. Prevent dehydration as the water gets lost from the body. If an oral intake or water is possible, have the user drink warm water and normal temperature sports drink. As the watery feces can irritate the skin around the anus, wipe or wash off the mess to keep the area clean. Acute diarrhea may cause by infectious disease. Report it to the medical staff. Excretion is affected by psychological stress. Carefully assess the condition of the user and listen to the user's complaint. Attentively observe the state and of the excreted urine and feces. If you suspect the physical problem, immediately report it to the medical staff. This will help protect the user's health. The process of activities involved in excretion. Many activities involved in the usual excretion. Excretion is related to complex function of nerve movement in the body. Process of activity involving in excretions. Number 1, individual becomes aware of urge to urinate or defecate, and then they enter to the bathroom. Then they pull down the pants, get ready to urinate or defecate, urinate and defecates, wipe and clean flush the toilet, pulls up the pants and exit the bathroom. The user who needs toilet assistance suffers from heavy psychological burden. It is necessary to provide nursing care, making sure that his or her dignity is maintained. Actuality of nursing care related to elimination need. Points to remember regarding the nursing care related to elimination needs. Stick to the user's excretion routine. Be considerate of the embarrassment the user feel. Pay attention to the user. Choose the appropriate method and tools for excretion. The care worker should use disposable gloves, apron, and prevention of infection disease. Example of the environment for excretion. L-shaped handrail. It is used at the time of standing up. Adjustable handrail. The handrail goes up and down to suit the condition of the user. Call button. The user can call the care worker when she or he is in trouble or is done with the toilet. And then we have the sliding door. It is easy to open door even for a wheelchair user. Actuality of nursing care related to elimination. Nursing care in the toilet. Explanation. Here is uses the user with left hemiplegia as an example. Guide the user to the toilet. Have the user hold the handrail and hand off the unaffected side. The care worker stands by the affected side of the user to maintain stability. The care worker stands by affected side user to pulse down the user's pants and underwear. The user holding the handrail sits on the toilet seat. Confirm that the user is maintaining a stable sitting position. The care worker goes out into the bathroom stall and closes the door. The user signals that he or she is done, the care worker is going into the bathroom stall. The care worker pulls up the user pant and underwear as far as they go. If the pants and underwear are pulled up halfway while the user is sitting position, it will reduce the burden during the standing position. The user is holding the handrail standing up. Confirm that the foot of the unaffected side is thrown back when the user stands up. If the user's standing position is stable, have him or her pull up the pants and underwear by himself. Confirm that the pants and underwear are fully pulled up. Nursing care in inserting type of bedpan. Get necessary tools and supplies ready. Draw the curtains for privacy. Adjust the height of the bed to suit the care worker. Place the waterproof sheet on the bed. Raise the user knee. Lift his or her lower back and pull the pants and underwear down. Lift the lower back of the user. Place the bedpan and so that the anal area is over the center pan. Confirm the bedpan is established. Put a towel over the user's abdomen for privacy. If the head end of the gauge is raised, it will make it easier to increase the abdominal pressure. Lift the lower back of the user, clean him, and remove the bedpan. Observe the skin. Place the user in the lateral position to remove the waterproof sheet. Put the underwear and pants up and tidy the clothes. Adjust the height of the bed back into the initial height. Confirm the user's physical condition. Clear away, clean and store the tools, etc. and dispose of the waste toileting using the urine bottle. And dispose of the waste toileting using the urine bottle. Male. Place the user to the lateral position, place the pillow, etc. at the back, and put the urine bottle in place. For the female, guide the urine into the urine bottle with the tissue paper, etc. so that the urine will not splash. Nursing care related to diaper change. Compare physical condition of the user. Explain to the user the purpose and the content of the action and obtain the consent from him or her. Get the necessary supplies ready. Adjust the height of the bed to suit the care worker. Place the user in the lateral position and spread the waterproof sheet in the bed. Turn him or her back to supine position. Lift the lower back and pull down the pants. Peel the tapes of diaper off. Clean the genital area with the warm water using bottle shower. If the user is a female, wash the wipe from the urethra and the anus that is front to back to prevent infection. Clean the area thoroughly even where there is a skin fold. The water temperature should be about the same as the body temperature. The genital area is temperature sensitive. Wipe away the moisture with a dry towel. Roll up and the soiled diaper. Turn the user to the lateral position. Fold the soiled surface of the diaper inward. So put a new diaper under the soiled diaper. Turn the user back to the supine position and pull out the soiled diaper from the opposite side. Remove the gloves after disposing the soiled diaper. Stick the tape with enough room to allow a few fingers to be placed in the abdominal and femoral regions. Strong pressure can cause itching. Lift the lower back and pull the pants up. Tidy the clothes and bed sheet. Wrinkled clothes and bed sheet can cause discomfort and pressure ulcer. Ventilate the room. Confirm the physical condition. Clear away the tools and supplies, etc. Properly dispose of the spoiled diaper. Okay, nursing care related to grooming. Significance of grooming. Grooming refers to the activities we perform to make ourselves neat, clean, such as washing our face, brushing our hair, and changing clothes. Grooming is not just to be physically clean. It involves expressing our individuality and is connected to psychological and independence. Grooming is important for the maintenance of relationship with others in the society. Washing of face, combing the hair, cutting the nails, changing clothes, brushing teeth, putting makeup, or shaving the face. Mechanism of mind, body, and body related to grooming. Nursing care related to grooming. Significance of grooming. Mechanism of mind, body related to grooming. Grooming is a method of expressing your individuality. It's important to provide nursing care, respecting the lifestyle and the values of the user. Assisting the user in his or her grooming activities will improve the user's will to live. Positive effects of grooming: help to adjust body temperature and protects the skin. Help maintain and improve mind and body function. Promotes a safe and comfortable life. Help bring variations of daily life. Help express your individuality. Points to remember regarding nursing care related to grooming. Respect the user's individuality such as lifestyle and preference. Provide support suitable for the season, the activity of the day, etc. Provide support suitable for the state of mind and body of the user. Clothes suitable for the season, for the summer and for the winter. Activity of nursing care related to changing clothes. Points to remember regarding nursing care related to changing clothes. Avoid exposing the skin and be considerate of the embarrassment the user feels. If the user has paralysis, undress him or her from the unaffected side and dress him or her from the affected side. Nursing care related to putting on, taking off outerwear for the user assuming sitting position. The explanation here uses the user with paralysis as an example. Confirm the physical condition of the user. Explain the user the purpose and contents of your action and obtain consent from him or her. Set the surrounding environment, adjust the room temperature, keep the clothes to wear after the change of clothes. Keep ready the clothes to wear after the change of clothes. Have the user choose the clothes that suits for her preference. People have preference about clothes. Clothes express individuality of the wearer. For a user with a visual impairment, have him or her touch the material and explain the design. Take off the outerwear. Confirm the sitting posture of the user is stable. The care worker should stand by the affected side. This is because the affected side is weak and user has a tendency to fall toward the affected side and rest starting from an unaffected side. Undress starting from the unaffected side. Unaffected side. The burden on the affected side is reduced by undressing from the unaffected side, which has wide range of motion. The care worker provides assistance where the user has difficulty in moving his or her arm or reaching with his or her hand. 6. Pull on the underwear. Pull on the outerwear. First, place the user arm of the affected side into the sleeve and confirm whether the user finds the outerwear comfortable. Confirm that there are not many wrinkles in the side of the clothes. Wrinkles and sags will make clothes uncomfortable to wear. Confirm that there is no change in the user's physical condition and that he or she is not feeling any pain. Nursing care related to putting on, taking off pants of the user's assuming sitting position. The explanation here uses the user with paralysis as an example. The procedure from 1 to 4 is the same as that for nursing care related putting or taking off the underwear for the user assuming the sitting position. Take off the pants and tell the users to hold on something stable if possible. Assume the standing position. Take off the pants. Standing position from the unaffected side. Or called daken shakan. Raising the leg makes it easier to lose balance. If the user is unstable in standing position, keep him or her sitting position and take the pants off as far as possible by tilting the upper body area of an affected side up. Assistance to suit the user's physical ability will prevent the user from falling. Put on the pants. The users maintain a sitting position and first puts his or her leg of the affected side into the pants on and thus the same with his or her legs of the affected side. He or she pulls the pants up as far as possible and then stands up and pull the pants up up to the waist area. Confirm whether the user pants is comfortable. Confirm there is no change in the user's physical conditions and that he is not feeling any pain. Nursing care related to changing clothes for users assuming a supine position on bed. The procedure from 1 to 4 is the same that for nursing care related on putting and taking off the outerwear from users assuming sitting position. Take off the outerwear. Take care. The care worker stands by an affected side of the user. Unfasten the button and take off the underwear starting from an affected side. Roll the taking off part of the clothes and put it under the user's body. Taking off the clothes standing from the unaffected sides help reduce the excess movement using the affected side. Place the users in lateral position with the affected side down. Pull out the part of the clothes under the user's body. Be careful not to put the paralyzed side down if the user has paralysis. Lastly, take off the sleeves of affected side. So, pag mag-change ka ng clothes, yung affected side nandun sa taas, in lateral position. So, yung base niya is the unaffected sides. We will help to stabilize the position of the users in lateral position. So, yun. Ngayon, put the outerwear. Put the sleeves on the affected side, while on the lateral position, put the other part of the cloth under the body of the user. Turn the user to the supine position and pull out the part of the clothes from under the body. Confirm the back of the side of the clothes are properly lined along the body. Put the arm of unaffected side into the sleeve, fasten the button, and finally straighten the clothes. Take off the pants. Take off the pants from unaffected side first. Unaffected muna. Pagtanggal ng pants. Tapos, if the user is capable of raising the lower back, ask him or him to do so. Unaffected muna, taking off. Tapos last na yung affected side sa pants. Put on the pants of the affected side first. If the user is capable of raising her lower back, ask him or her to do so. Confirm whether the user finds the pants comfortable. Confirm there is no change to the user's physical condition, that he or she is not feeling pain. Okay, we go to nursing care related to face washing. Hair dressing, shaving, nail clipping, and putting on makeup. Points to remember regarding nursing care. Related to face washing, washing your face when you wake up in the morning will make you get rid of the dirt and on the skin feels refresh. And have a user moisture the skin after washing the face to prevent dry skin. With one towel, wipe the face of the user who cannot wash his face or herself. Points to remember regarding nursing care related to hairdressing. Hairstyle preference differs from person to person. Confirm the condition of the hair and scalp. Brushing the scalp increases blood flow. Use tools to suit condition of the user. The brush can be used by person without raising her hand. There's a long brush. Points to remember regarding nursing care related to shaving. Preference on how to grow beard differ from person to person. When you use the electric razor, hold it right angle to the skin. Shave lightly, stretching the wrinkles. Check if there is any stubble left unshaved. Protect the skin with shaving lotion, etc. Points to remember regarding nursing care related on nail clipping. If you do not care of your nails, dirt accumulates between the nails and the skin, makes the area filthy. And moreover, long nails can harm the skin. Nails are affected by health condition. Clip the nails while they are soft after the user takes a bath. Confirm the condition of the nails and surrounding skin. Squared off nails is perfect. Nails cut too short is not good. Almond-shaped nails is not good. We have a nail clipper and nail file. Points to remember regarding nursing care related to putting on makeup. Putting on makeup is an expression of individual. Adapt the preference and desire of the user. Remove the user's makeup and treat any skin condition before going to bed. Oral care. Significance of oral care. Help keep the oral cavity clean, prevent decaying teeth, periodontal disease, and halitosis. Bad breath helps reduce the number of germs in oral cavity and prevent the aspiration pneumonia. Helps remove saliva secretion and prevent dryness of the oral cavity. Helps maintain the sense of taste and increase the appetite. Points to remember regarding nursing care related to brushing teeth. First, have the users gargle. Brush each tooth with short, quick motion, leaving the tooth unbrushed, leaving no tooth unbrushed. Observe the state of the oral cavity. Pay attention to the oral cavity area of the affected side of the user with paralysis, as food pieces tend to left on that side. If you find bleeding on swollen gum, report it immediately to the medical staff. Nursing care related brushing teeth from the oral cavity. Prevent aspiration by providing nursing care. Establish eye contact and the same level as that of the user. Nursing care related to brushing the teeth from the back. Do not leave the chin of the user, as it can pose a risk of aspiration. Placing your hand this way will help keep the head of the user in his position and maintain a suitable posture. How to hold the toothbrush? Hold the toothbrush like holding a pencil. This will prevent damage in the teeth and the gum, as prevent unreasonable force from being applied. Using a sponge brush. If it's not possible to use toothbrush for cleaning, use the sponge brush. Prevent aspiration by providing care. Establish eye contact and same level as that of the user. Keeping the denture clean and its storage. Denture are replaced for lost teeth. There are full and partial dentures. They need to be removed and cleaned after each meal, as they tend to cause propagation of bacteria. Use the brush and clean with running water. Dentures need to keep moist and prevent crack. Store the denture in water denture solution in container. After removing the dentures, brush the remaining teeth. Full dentures for upper jaw and the lower jaw. And we have the partial denture.